Hello friends, welcome to Pediatrics by Dr. Saman Fatima. Let's quickly learn 3 very high yielding points about breastfeeding. Point number 1, about composition of breastfeeding. Breast milk is composed of foremilk and hind milk. Foremilk and hind milk. So foremilk is watery. It is watery and so it quenches thirst of the baby. It is also rich in minerals and vitamins, sugar as well as protein. Hind milk, if we talk about hind milk is rich in fat and so also rich in energy, and it quenches hunger of the baby. Coming to point number 2, which fatty acid is present in human milk, which is very important for brain development. So fatty acid present in breast milk, important for brain development of the baby. It is DHA or docosahexaenoic acid. DHA. Fatty acid present in breast milk important for the brain development of the baby is docosahexaenoic acid or DHA. Point number 3. How do we store breast milk? About storage of breast milk. So breast milk can be stored at room temperature. It can be stored at room temperature for 6 to 8 hours. At room temperature for 6 to 8 hours. Inside refrigerator for up to 24 hours. And in deep freezer, inside freezer, that is at minus 20 degrees Celsius, it can be stored for 3 to 6 months. So the breast milk can be stored at room temperature for 6 to 8 hours. Inside the refrigerator, it can be stored for up to 24 hours. And inside freezer, where temperature is minus 20 degrees Celsius, it can be stored for 3 to 6 months. Point number 4. What are the contraindications of breastfeeding? So please remember, there is absolute contraindication. So absolute contraindication, because breast milk is rich in lactose, breast milk is rich in lactose. So absolute contraindication is if the child is suffering from galactosemia. Absolute contraindication is if the baby is suffering from galactosemia. What are the relative contraindication? What are the relative contraindication of breastfeeding? Where breastfeeding can be given in certain situations. What are these? If mother is having active tuberculosis. Second, mother is HIV positive. So these two are relative contraindication. What is the absolute contraindication of breastfeeding? Absolute contraindication is galactosemia. What are the relative contraindication? Relative contraindication if the mother is having active tuberculosis or the mother is HIV positive. Let's once again revise these 4 high yield points. So about composition of breast milk. Breast milk has 2 different entities, foremilk and hind milk. Foremilk is rich in water, minerals and vitamins, sugar and protein. It quenches, because it is watery, it quenches thirst of the baby. Hind milk comes after foremilk. It is rich in fat and energy, and it quenches hunger of the baby. Second point, fatty acid which is present inside the mother milk, which is very important for the development of the brain of the baby, is DHA. Docosahexaenoic acid. It is very important for the brain of the development of the brain of the baby. Point number 3 about storage of the breastfeeding. Breast milk can be stored at room temperature for 6 to 8 hours. It can be stored inside refrigerator for 24 hours. It can be stored inside freezer at minus 20 degrees Celsius for 3 to 6 months. About contraindication of breastfeeding, absolute contraindication of breastfeeding is galactosemia in child, in the baby, and relative contraindication if the mother is having active tuberculosis or mother is HIV positive.